Hi, I'm Chris Sweeney, Director of Social Care Practice at System C, and I head up our practice division, which looks primarily at legislative change. And one of the largest changes that we've got at the moment that we're looking at is the Families First Partnership Programme. And my social care consultant, Sue, has been leading on that from a System C perspective. I was going to talk to you a little bit about what we've been doing in this area. Sue.
Hi, yes, I'm Sue and I'm a practice consultant at System C. And as Chris said, a big focus of mine has been Families First Partnership Programme, the biggest change in a generation for social care practice. So at System C, we've been working really closely with the DfE around how the system can best support that practice and reflect that journey for children and families. So we've worked really closely with them developing an interim solution, because I think that's what's been really challenging for local authorities is that there's been different stages of this, so different authorities are at different points in their journey, and working with local authorities and the DfE to be able to develop a solution that predominantly and primarily reflects that practice, but also enables them to capture some of that data that's still very much required while the DfE work forwards around what that looked like in the future. And it's been really good to work alongside the DfE and have the input from our customers, from our local authorities, to develop something that enables them to reflect that right now, but mindful of us still being on that journey and local authorities still being on that journey. And so now we've got to the point where there's an interim solution which is manageable for local authorities to do, that doesn't involve lots and lots of work to get the system to where it needs to be right now to reflect that practice. But then also we continue to work alongside them and we're continuing to pull together local authorities, our customers, and work alongside the DfE to look at what it might look like in the future. Mindful that is still very much, it's ongoing. We're still learning, the DfE is still learning from where the focus needs to be, where things need to go. And I think that's a really exciting journey. And I think what I've really loved about that is the focus on that practice. That's really driving where we're moving towards with our solution. And I think that's been really, really positive. And having that engagement with the DfE, being present in all of those drop-in sessions, being present on those forums with the DfE, having that ongoing conversation. So it feels more like we're on this journey together, working all together to really create something that works for families.
Yeah, and I think that's important, particularly given the amount of change that there is going on more broadly in the sector at the moment, with things like the local government reorganisation and the Mental Health Act receiving royal assent and moving forward, and consultations on deprivations, and then the way that Families First links in with the NHS 3 shifts and moving to a neighbourhood basis. There's so much that's interlinked and going on, and we need to make sure that the practice that comes out of this and how we move the systems forward is in the best way to support social workers in their day-to-day roles and to ensure that the departments get the information that's required out of them.